Oh, perfect. Better. That was good.
That was so good.
Thank you so much. Yeah, my pleasure. Glad we could help. Hey, it's Dr. Denke at Select Spinal Sports Medicine in Friendswood, and today we're here with Miss Kylie, former homecoming queen at Friendswood High School. She's proud, I'm proud of her, and also she's a college volleyball player, both indoors and sand volleyball. So she is here on a break from school. She's kind of beat up, little shoulder pain, back pain, hip pain. She likes to wait till the last minute. But we've done some treatment. We're going to do some active release on the lower back and hip now, and then do some adjustments. So here we go. We're going to start on this lower back right side. I'm going to have you sit up straight. I'm going to come in here, contact right on this lower back right side. I'm going to hold here, and then I'm going to have you roll your shoulders down, forward, good, and back up. Does that feel okay? Good, sit up straight all the way, good, and roll again. So she's having some lower back tightness on the right side. I checked her out. She's obviously jumping off of the right leg a lot more, and she got a lot of tightness in her hip flexor. She was saying when she does some abdominal workouts that she feels some kind of popping or snapping in the front of her hip. That's commonly known as snapping hip syndrome, when the psoas tendon snaps over a little bony process and creates that popping sensation. So lack of flexibility there in the hip flexors can be an issue, along with weakness in the hip stabilizer muscles, glute medius, glute minimus, which both then correlate to tightness in the lower back. So we're working on that a little, and then we're going to work the hip out and do some adjustments. That feel okay? Mm-hmm. Okay, now I'm going to have you lean to the left. So now we're going to get in here a little bit deeper, a little more off to the side, into the Quadratus Lumborum, which is kind of a hip stabilizer, but also moves the trunk towards the right. So now we're stretching it to the left while we hold pressure to loosen up. Is this more uncomfortable than going forward, or the same?
More.
Yeah?
Yeah.
This muscle's a little tighter, so I figured. One more. Good. Relax. Okay. Now, lay on your side facing that way. Dig into this hip a little bit more. So we have glute medius here, and then glute minimus that comes back a little bit more. She's jumping a lot off of this hip, so these muscles tend to get worn down a little bit more. Overuse, we'll say, right? So we're going to contact there, stretch these muscles while I hold pressure, again, in an effort to get these to relax a little bit more. So I'm going to hold here. You're going to bring the knee up to there. You all right? Mm-hmm. Good. Come back down and repeat. If it's too much, let me know.
Okay.
So how'd your team do this year in volleyball?
Pretty good. We had a new coach, so it was very interesting. But
How about your sand volleyball? Is that 2-on-2?
yes, it was so much fun.
So I'm sure you won, right?
Of course. Yeah, it was awesome. I played with an extra year senior, so
Oh yeah?
that was fun. Yeah, so you're like the little freshman senior deal. So it was fun.
I used to be pretty good at sand volleyball too back in my day. Let's say I was a feared server. Might not look like it, on the height side, but I was pretty good. All right, one more. Good, relax. All right, now we're going to stretch the hip flexor. So I'm going to stabilize you here. We're going to bring this back. Is that okay? You feel a good stretch there?
Good, yeah.
Good. Okay, now turn on your stomach. We're going to do some adjustments here. Drop that down. Good. Okay, so drop the hands to the floor, and we'll start up here and work my way down. So I'm going to just feel around here. here and here. And take a deep breath in, let it all the way out. Perfect. Good, again. Good. Now, breathe in and hold your breath. Perfect. All right, relax. Now we're going to come back up here a little bit. We worked on the shoulder before we started this, but she's got a bit of a rotator cuff problem. Kind of an ongoing thing, right?
Yep.
Over here. Is that tender right there?
Yep.
Okay. So we're going to go pressure here. I'm going to tilt your head to the other side. A little pressure right here. Okay, nice and easy.
Oh my.
That was good?
Yeah.
Good. All right. Same thing right there. Good. Perfect. Okay, now turn on your side facing this way. So we're going to go straight leg on the bottom. Good. Bent there. Good. And then you're going to hold here and here. Now this is the side that was less tight.
Mm-hmm.
They're both kind of tight. This side was less tight. Alright, so I'm going to roll it. Scoop this way just a little more. Good. Keep that one there. Good. Good. Alright, nice and easy here. Perfect.
Oh.
Okay. That's alright?
Yeah.
Go that way now. So we're going to go there and there. Switch here. And roll this way. This was the tighter side.
Mm-hmm. Oh.
Didn't get any better than that, right? Okay, now lay on your back. Let's get the hips. So we'll go here. Keep this nice and relaxed there. Relax it. That's good. Okay?
Yeah.
Hopefully we get the same out of this one. This is the tighter one in the hip flexor, which kind of draws that hip up tighter and doesn't allow it to move as easy. Ooh, that was really good. Okay, now slide up this way and let's get your neck. Come up a little more. Very good. Relax. A little tender there.
Mm-hmm.
Not too bad. Let's just loosen this up a little bit here. Alright. So I'm going to lift you here. You just let me do it. Good. Just keep everything nice and relaxed here. Just let your head drop into my hand here. Good.
Mm.
Good. Alright, now let's do this side. Right there. Same thing here. Keep it nice and relaxed. Perfect. Alright, leave your hand up.
Oh.
That's it for Miss Kylie. Hopefully she's feeling like a brand new person now, right? Ready to go off and win some more games. Thanks for watching. We'll see you next time.
Yay.